What's going on, everyone? Ali Reza here, back with a brand new episode of Iran Tech. And in this week's episode, we're going to be talking about something that has given hope to millions of couples worldwide, and that is advancements in the field of reproductive health and infertility treatments. Now, these issues, these conditions that affect fertility, not only come with physiological effects, but they also have a lot of mental side effects, because it could be very difficult for couples to know that, at least at the moment, they're not able to have kids. And one such issue that affects women is called endometriosis. It's a condition that is often misdiagnosed and maltreated. So in this week's episode, we're going to be exploring endometriosis in depth, talking about how we can diagnose it more properly and how we can treat it better. So don't go anywhere, stick with us. Before we get too deep into the explanation of what endometriosis is and how it is treated, though, let's hear from the head of Avicenna Infertility Clinic, which is where we are, about how they're using the equipment, the facilities, and the specialists that they have here to tackle all sorts of issues when it comes to reproductive health and infertility.
The Avicenna Specialized Center has been established with the goal of creating a one-stop clinic. Among the 128 infertility treatment centers in Iran that provide services to couples in need, this center is recognized as a referral and reference hub. This means that all the services an infertile couple might require, or the issues causing infertility, can be effectively treated at this center. One of the most significant conditions leading to infertility in women is endometriosis, which is notoriously difficult to diagnose. Utilizing tools and methods that allow for an accurate diagnosis without relying on invasive procedures like surgery is a highly critical and delicate task. At the Avicenna Specialized Center, we excel in this area through the expertise and skills of our specialists, as well as the use of advanced paraclinical tools such as ultrasound. Once the diagnosis is confirmed, we coordinate the necessary team for surgery. Finally, these surgeries are performed in a hospital setting equipped with state-of-the-art laparoscopic tools and advanced technologies in well-equipped operating rooms. This condition, globally prevalent in 8 to 10% of women of reproductive age, is associated with two major complications: infertility and pain. Particularly in advanced grades and forms of this disease, affected women often endure persistent pain throughout the day and night, making life increasingly challenging. We are proud to have skilled and highly capable surgeons who, alongside an expert surgical team and advanced technologies such as laparoscopic systems, and soon robotic systems, diagnose and treat this condition in the best possible way, relieving patients from this debilitating pain. Over the past 3 consecutive years, we have had the honor of being ranked #1 globally by an international society of endometriosis centers. This recognition highlights the quality of our treatments and the large number of patients treated at our center, making us the top-ranked facility among registered centers worldwide.
So what even is endometriosis? Endometriosis involves the growth of tissue similar to the lining of the uterus in areas where it shouldn't be, such as the ovaries, the fallopian tube, and pelvic lining. Now, this can result in a number of symptoms ranging from debilitating pain to severe menstrual irregularities, as well as, in a lot of cases, infertility. Now, because this is such a complex condition to diagnose, it is often misdiagnosed, and the symptoms for it are misunderstood for symptoms of other conditions, and this will leave a lot of women in desperate need for care for this condition behind. But before we get into how the treatment process works, let's take a closer look at a visual breakdown of endometriosis.
Let's get a bit more familiar with this condition. It's a medical condition where tissue similar to the lining inside the uterus, called the endometrium, starts growing outside of it. This abnormal growth can occur on the ovaries, fallopian tubes, the outer surface of the uterus, and even on other organs in the pelvic region. Unlike the endometrial tissue inside the uterus that sheds during menstruation, this misplaced tissue has no way to leave the body. Over time, this can cause inflammation, scar tissue, and adhesions, bands of fibrous tissue that can bind organs together. These physical changes are a big part of why endometriosis is so painful and disruptive. The symptoms of endometriosis vary widely. It may cause severe menstrual cramps, chronic pelvic pain, or pain during and after any sexual activity. Others might experience infertility, fatigue, bloating, or irregular bleeding. These symptoms can make everyday activities, relationships, and work more challenging. It's important to understand that endometriosis is more than just bad periods. It's a complex condition that can deeply affect both physical and emotional well-being. Diagnosing endometriosis can be a long process, as its symptoms often overlap with other conditions. Diagnosis may involve imaging tests like ultrasounds or MRIs, and in some cases, a laparoscopy, a minor surgical procedure to look inside the abdomen. But more than anything, it requires a professional who can recognize the signs. Raising awareness about the condition is key to ensuring that people experiencing symptoms seek medical advice and receive an accurate diagnosis sooner. So, those were the basics of endometriosis. And now to diagnosing it and its challenges.
One of the common frustrations that women who deal with endometriosis face is the common misdiagnosis of the condition with other ones, such as irritable bowel syndrome or ovarian cysts. And sometimes they're even told that their condition and their symptoms are completely normal and nothing to worry about. Now, not only does this often result in untimely and ineffective treatment, but it can also lead to unnecessary procedures such as the complete removal of the uterus or hysterectomy, which is almost never the right solution. So to better understand the challenges that specialists face in diagnosing this complex condition, we've actually talked to one of the specialists at this clinic.
The first step in diagnosing endometriosis is conducting an interview with the patient to obtain their medical history and perform a clinical examination. Additionally, imaging techniques can be employed to assess the severity of the disease, identify the affected areas, and map the condition. The primary diagnostic method is ultrasound, which is widely available and cost-effective. It is performed using two approaches, vaginal ultrasound and rectal ultrasound for women who are virgins. This procedure is carried out by radiologists and specialists who are knowledgeable and skilled in diagnosing endometriosis, particularly in identifying deep lesions. Ultrasound provides reliable information about the severity of the disease, with a sensitivity and specificity rate of approximately 80 to 85%. Another diagnostic modality is MRI, which is particularly useful for patients with suspected malignant ovarian cysts caused by endometriosis, lesions involving the ureters, or in cases where ultrasound cannot be performed for any reason. MRI serves as an effective alternative for comprehensive evaluation and diagnosis. After completing the imaging studies, we conduct a follow-up consultation with the patient to discuss the severity of the disease, the affected areas, and the necessary steps moving forward. We may also utilize laboratory tests, specifically tumor markers, to assess the nature of cysts. These tests are requested for some patients based on imaging results and the patient's age. However, it's important to note that none of these methods can fully rule out malignancy. Although the risk of malignancy in endometriosis-related cysts is relatively low, at around 2 to 3%, we always evaluate this possibility and discuss it thoroughly with the patient to ensure informed decision-making.
Endometriosis is a chronic condition that can affect every aspect of life, but the good news is that there are several treatment options available to manage its symptoms and improve quality of life. It's personalized to the individual's needs, whether it's reducing pain, improving fertility, or addressing other health goals. The first line of treatment often involves medication. Hormonal therapies such as patches or intrauterine devices, IUDs, can help regulate or stop menstruation, which reduces the growth of endometrial-like tissue. For some, medications like GnRH agonists or antagonists may be prescribed to temporarily suppress ovarian function and reduce symptoms. Over-the-counter or prescription pain relievers can also be part of managing discomfort, particularly during menstruation. For those whose symptoms don't respond to medication, surgery might be recommended. Laparoscopic surgery is the most common approach. During this minimally invasive procedure, a surgeon removes or burns away endometrial tissue growths while preserving as much healthy tissue as possible. This can significantly reduce pain and, in some cases, improve fertility. However, it's important to note that symptoms can sometimes return after surgery, so follow-up care is essential. Lifestyle adjustments can also play a critical role in managing endometriosis. Many find relief through regular physical activity, which can help reduce inflammation and improve overall well-being. Dietary changes, like adopting an anti-inflammatory diet rich in fruits, vegetables, and omega-3 fatty acids, may also help alleviate symptoms. Stress management techniques such as yoga, meditation, or therapy can be beneficial in addressing the emotional and physical toll of the condition. For individuals struggling with fertility due to endometriosis, specialized fertility treatments such as in vitro fertilization or IVF, working with a reproductive specialist can help tailor a plan to optimize the chances of conception. Treatment for endometriosis isn't one size fits all. It's a journey that requires collaboration between patients and healthcare providers to find the best approach for managing symptoms and improving quality of life. And that's a brief outlook on how endometriosis treatment looks like.
Avicenna Infertility Clinic offers specialized care across multiple departments to address infertility from different perspectives. The Infertility Treatment Clinic focuses on identifying and managing fertility challenges through advanced diagnostics, imaging, and personalized treatment plans. The Replacement Therapies Clinic provides services like egg, sperm, and embryo donation, as well as surrogacy, adhering to legal and ethical standards. The Pelvic Pain and Endometriosis Clinic, the focus of this episode, specializes in treating endometriosis and chronic pelvic pain through minimally invasive laparoscopic techniques among other methods just mentioned. The Embryology Clinic focuses on assisted reproductive technologies such as IVF, ICSI, embryo freezing, and genetic embryo screenings. The Andrology Clinic addresses male infertility with advanced diagnostic tools, semen analysis, and tests like sperm DNA fragmentation assay, SDFA, to identify and treat sperm-related issues effectively. Finally, the Cell Therapy Clinic explores stem cell-based treatments, focusing on ovarian insufficiency and operating endometrial stem cell bank for research and clinical use. These clinics work collaboratively, combining medical expertise, advanced technology, and research to address infertility from multiple angles, providing comprehensive care for couples seeking to build their families.
The work that the staff members here at the Avicenna Infertility Clinic are doing, the researchers and the specialists, have helped give hope and healing to thousands of couples who've had infertility issues, including endometriosis. And we certainly wish them the best of luck in their pursuits of keeping up with the bleeding edge of science when it comes to infertility care. Thank you very much for watching another episode of Iran Tech. I'll see you guys next week.